Hello Facebook friends. Today, like I promised, we're going to discuss cervical cancer, and this is the first in the series of videos that I'm going to do on this subject. So today I'm going to address the issues to do with what is cervical cancer, what are the symptoms, what are the risk factors. Remember, I'm not talking about the causes of cervical cancer, I'm talking about the risk factors, and how do we manage to lower the risks. Number one, what is cervical cancer? Cervical cancer, like any other cancer that you know, is basically an abnormal, uncontrolled growth of cells on the cervix. And what are the symptoms and signs? How do you know that this person or that person, how do I know that I have cervical cancer? The symptoms of cervical cancer are abnormal vaginal bleeding, foul smelling vaginal discharge, pain. Now, you'll find that these symptoms, and the propensity to infection, you find that these symptoms, they appear when the cancer has fully established itself. So before the cancer is fully established, it actually has no symptoms. You wouldn't know. Now, what are the risk factors? Who is likely to develop cervical cancer? Very quickly, number one, women who are infected by human papillomavirus, HPV. So HPV infection increases the risk of developing cervical cancer. The other risk is a lowered immunity. So in women who are HIV positive and who have developed AIDS, the chances of developing cancer are increased. And anything else that lowers immunity, like drugs. The other risk factors have to do with diet. If you have a diet that is low in vegetables and fruits, your chances of developing cervical cancer are increased. Smoking, tobacco in all its forms has been seen to increase the chances. The other issue that increases the chances or the risk, and this one I have to be a bit emphatic and very careful in the way I'm emphasizing it, prolonged use of oral contraceptives. The other one has to do with early sex debut. Early sex debut, people who indulge in sex very early on in life. And then women who get pregnant very early, especially before the age of 17 you're pregnant, and also women who have so many pregnancies, that increases the chances of developing cervical cancer. Others have to do with socioeconomic status. It has been observed that women who live in very poor, low socioeconomic status conditions, their chances of developing cancer increase purely because of lack of access to medical services. So they are not screened on time, they have no way of finding out early, so that it has been observed to increase the chances. Those are some of the risk factors I thought I should emphasize. Now, how do we prevent? Or how do we lower the chances? Some of the strategies that have been put in place. Remember that any cancer that has an opportunity to screen also gives an opportunity to prevent it. For example, if you can vaccinate children early, especially girls, against HPV, the chances of them developing cancer as they grow older are lowered. Now, I will do another video just on HPV alone, just to clarify certain questions that may arise around the vaccine. That will be another video on another day. The other thing that we do is to catch the cancer early. Any cancer that can be caught early gives you an opportunity. That's why we do pap smears, particularly in women. And we'll do another video in detail on pap smear. For today, I thought I should just conscientize you on these issues. That number one, to prevent cancer, we need to vaccinate girls against human papillomavirus. We need to get as many women as possible to be going for pap smear screening, and also other factors that relate to increasing the likelihood of cancer should be managed. For example, anything that lowers the immunity should be taken care of. We need to prevent this issue of having so many pregnancies and getting pregnant very early in life. We need to make sure that teenage pregnancies are lowered. If you look at our statistics, teenage pregnancies are too high in this country. And other factors that I have also talked about: smoking, tobacco in all its forms, which brings in the issue of sunko. Someone asked about sunko. So sunko, I can argue that sunko can increase the risk of developing cancer, cervical cancer. So that said, in the next videos that will follow, I'm going to address pap smear on its own in detail. And then after that, I also look at the human papillomavirus question as it relates to vaccines on its own. Have a nice day and good day.